Dippin' Dots. Take Dippin' Dots. That is a Microsoft tag reader. I'll just explain to you. If you go to gettag.mobi with your iPhone, Android, BlackBerry, you'll be able to take a picture of that. It's the first time I've ever done something like this. Maybe you guys might be able to do it, and it'll be a little surprise. So let's start. We're going to talk about nurses and social media. We all probably are tired of social media, the marketing, all that talk. I believe that, first of all, health is social. I think at the cellular level and at the collective level, it is a very social thing. I also believe that social media comprise three things. It's social, it's technological, but it's also ideological. And I also believe that these media, that these emerging media, not just Twitter and Facebook, but the future of media like this, where interfaces will change, and as technology gets cheaper and faster and stronger, I think that there's a lot more to social media. I think it's very deep. We've only seen the tip of the iceberg. So I'm here to tell you about what nurses are doing and what the future of nursing and social media looks like in my judgment. And what I believe is happening is that these media are opening new doors of communication, connection, and I think this is a great opportunity for nurses to enter the conversation. And in fact, I think nurses and physicians and healthcare in general should be the leaders in the conversation about social media, because these technologies have ideological implications. It's disrupting our culture, it's disrupting the way that we conduct business, it's changing our positions. If you look back at the history of our species, there's always been times where there's been abrupt changes. From the time of the printing press, it created new ways of sharing information. It led to the disruption of societies, and it led to new ideologies, and it also led to a lot of conflicts. Well, what's happening with these media, unlike the revolutions of the last, say, 400 years, this isn't taking place over centuries. It's taking over a very, very short time, years, in some cases weeks. And the reason I think nurses need to be involved in this conversation is because I consider nurses the last Jedi Knights of this republic. And it's a perfect analogy. They are connected to the Force in the sense that nurses have to have a very powerful intuition. And intuition is not something that's just a mystical, transdimensional thing. It's a very real accomplishment of evolution of our brains. And nurses, what do nurses do? Well, they're experts at technology. They have a lot of body wisdom, especially the ones that are bedside nurses. They understand human nature, and what nursing is really about is it's about answering the question of what is the effect of all this stuff from wellness to sickness. And if you look at sickness, what's the effect of a disease on a human being? What's the effect of a diagnosis? What's the effect of all the treatment and all the stuff we do with it? Somebody has to look at the overall effect, the psychological effect, the family effect, sociological effect. And it's a very important thing. And when we're talking about technologies which are radically changing the way we do things, and we don't know which way this is going to go, we need people who understand that part of the human condition. And that's what I'm hoping. So what are they doing? Well, I run this thing called Orange Chat. And when I started this back in September of last year, there were very few nurses on Twitter. Probably about 25 or 50. Now there's probably thousands. So what we do in Orange Chat is it's pretty open, it's open to the public. It's a great way for nurses to network. I call Twitter a gateway drug for nurses. It's a gateway drug for everybody, right? I also think Twitter, by the way, is a lot more than just social media. I think if you follow along the conversation, I give examples of how Twitter is really a fundamental unit of technology. And I think that the premise of Twitter, not twitter.com, but the idea of short bursts of information and the ability for that follower relationship, we're going to start to see machine uses of that technology, which is probably going to blow us away. I mean, you could conduct combat operations with Twitter, and I would love to see applications where you could hook up, say, continuous glucose monitoring to an infusion pump. That would, for instance, make it safer so people don't get dangerously hypoglycemic. So that's just one application. Education, there are a lot of nurse educators that are starting to incorporate this into education. RSS feeds are being used in classes to push out content. So, but I'm going to cut this short by just saying that, as I said, nurses are the juggernaut of the Republic. If we understood what nurses really did, if we can get nurses more involved in this conversation, I do think our healthcare system will be a lot better.